Good afternoon. I'm George Latimer, Westchester County Executive. This is Monday, January 4th, and this is the first update on the Westchester coronavirus outbreak, first update of the new year, first update of the week. We will be back again a little later in the week for a second update to track where we are with the virus. I'm joined by Deputy County Executive Ken Jenkins, who will be reporting on one of the elements today that will be before you. Our Director of Communications, Catherine Chaffee, is available for anyone from the press that has any questions. We'll take questions at the end of the presentation, and obviously those of you who are watching on Facebook will make comments on the comments section, and we'll try to be as thorough as we can given the information we have. The numbers for coronavirus continue to rise, and they continue to show what I think we all believe is the spike that comes out of the Christmas holiday season, and then perhaps in the days to come, what may come out of the New Year's Eve spike. In both of those two cases, in Christmas and New Year's, just as we had with Thanksgiving a little over a month ago, we have a time where people get together socially. They do not necessarily meet in community settings. There was no ball dropping either in Times Square or in White Plains this year. There was no Christmas caroling on the street corners in our various areas, no Christmas pageants in the various local schools. And we also had very little of the holiday party, public holiday parties in the restaurants and so forth. But there is still human contact. And at a place where the reach of the county health department or the state health department cannot go, in private homes of Westchester residents and Americans in general, the virus has continued to spread. This was predicted by Dr. Anthony Fauci well over 2 months ago when he said January could be the worst month of the pandemic, and we're only a couple of days into it. It's too early to say if that's going to be the case or not, but we certainly see an uptick. The immediate numbers for today that have just come out on the New York State Tracker: year-to-date, 72,762 cases of coronavirus. 63,373 of those cases were 2 weeks ago. And so that gives us a difference of 9,389 active cases. The 9,389 compares to 7,957 just a week ago. So that's an increase in 1,400 active cases in 1 week. Now, most of these active cases really represent how many people tested positive over the last week. And so there's a very, very high number of positives. We had a day on Saturday, Friday into Saturday, where over 1,000 people on that one day alone tested positive. So when we look at the number of people that have gotten through the protocol for a 2-week waiting period, they drop off the active list because, in theory, their antibodies have fought off the disease effectively. We now see that the higher numbers of positives represent an expansion of the disease, and that more people are infected now than were before. We were hopefully optimistic about a week, 10 days ago, that we saw the numbers starting to decrease just a little bit, and now they've increased much more dramatically. The number that we are at today at 9,300 is analogous to numbers that we had back in April. The peak in active cases was 12,000 active cases. We're currently at 9,000, round numbers, 9,400 active cases. So we're not far from the peak. And the way we've jumped up in the last few weeks would lend us to think that we still have climbing to do. 2 weeks ago, we were at 8,000. 3 weeks ago, we were in a similar situation before we climbed to the 9,300 mark. But if you go back just before Thanksgiving, the caseload number was at 6,000. So in the space of a month plus, we've gone from 6,000 to 9,000. That same increase would take us to the peak, tie the peak at 12,000 cases. Let's hope that doesn't happen. We've tested 1,459,000 individual tests. We know now that there's duplicate tests by people who have been tested for COVID, and the population of Westchester is under 1 million. So clearly we're now at a point where there's multiple testing, and it's reflected in the numbers. We have lost 1,683 people to COVID. And when we look back over the last few weeks, we've lost 31 people from a week ago today to today. And the week before that, we lost 41 people. So those numbers are still significant. To give you an idea of how much more fatalities we've had recently, we have lost 165 Westchester residents from Thanksgiving Day to New Year's Day. Thanksgiving Day is just, fairly recent in our memory banks. That happened after Election Day, after Veterans Day. Thanksgiving Day was the 26th of November. New Year's Day just 3-4 days ago. 165 people died in that 6-week period of time. We lost 165 people also in the period that began on May 23rd and ended on October 20th. And that is a span of 5 months. So during the tail end of May, all of June, all of July, all of August, all of September, and most of October, we lost 165 people. We've lost the same amount of people in 6 weeks. And what's the difference? The difference is we've come indoors, and the difference is we've had Thanksgiving, we've had Christmas, and we've had New Year's. We've had activities where people get together, and we have the protocol. Wear masks. You don't want to wear masks. Social distance. We're all family. We're not going to social distance. Don't tell me how to live my life. We've lost 165 people in the same 6-week cohort as we lost 5 months during the summertime. Those are very sobering statistics. We hope that we'll see a cresting, a flattening of the curve here, but we have no reason to think that's going to happen given the numbers we've seen. The last number we have on hospitalizations is 455 people hospitalized as of Saturday, January 2nd. 455 people hospitalized. The week before that, 1 week before that, the number was 392. So in the space of a week, we had a net increase of 63 people hospitalized. Now, these are net numbers because there are people who are hospitalized who get well and go home. There are some who are hospitalized who become fatalities. But the net result still went up by a significant total of 63 individuals. The week before that, 2 weeks ago from the last hospitalization number we had, we're at 353 people. So in the space of 2 weeks, we had 100-plus people hospitalized, and that represents roughly 25% of all the people hospitalized now. So those are very significant numbers. Those are serious numbers, and they should make each of us pause as we go forward. A couple of things that we want to report on very specifically. First of all, you may note that a couple of weeks ago, the CDC came out with a new protocol for how long you had to be quarantined when you have not reported symptoms, even after a negative test. And that was going from 14 days to 10 days. But Westchester County Department of Health is subservient to the New York State Department of Health, and they did not change the protocol. So we continued with a 14-day quarantine period up until the announcement that was made just last week by Governor Cuomo, which indicated that the quarantine guidelines have been updated. They have been brought into line with the Center for Disease Control guidance. So those individuals exposed to COVID-19 can end their quarantine after 10 days without a testing requirement, as long as no symptoms have been reported during the quarantine period. Now, since the beginning of the pandemic, these rules in a host of different areas have changed. They've changed because there's more information known about the virus, because medical professionals reassess what has been set up as standards. There was a point in time at which you could not be released from your responsibilities to quarantine until you had a negative test. Then that was lifted. It wasn't required a negative test, just no symptoms at the end of a certain amount of time. And now we're reducing the number of days from 14 down to 10. For most people that have to quarantine, 10 days is a significant amount of time to be, outside of the normal flow of your life. Except that it's in those periods of time that you might be contagious, and the possibility of your contagion could then give this disease to other people, and that's how it spreads. And so the public health individuals, because while we have a vaccine now that once it's distributed can prevent you, reduce the likelihood that you'll get the disease, we have not yet developed a viral treatment that kills the disease. So therefore, if you contract the disease and you get the viral treatment, antiviral treatment, and then you survive it based on that treatment, you get well, you go home in a couple of days, that does not exist yet for medical science. So we still have to assume that reducing the amount of spread is the single most important thing we can do. That's what a vaccine does. It reduces the spread by making sure less people get the disease. But those who do get the disease, if they don't quarantine or isolate if they test positive, they can still pass the disease along, and the numbers can go up. And we have plenty of anecdotes about those folks who have died. I've noticed that there are people that I know that have now succumbed to COVID. I have a good friend of mine, public official, who has relatives now. One has died, one is in serious situation. We pray for the individuals involved, but we know that it can strike anybody. You may have noted, if you follow the national news, that some elected officials, a congressman-elect out of Louisiana died of COVID, 41 years old, no underlying diseases. Recently elected to Congress on Election Day, not that long ago, was a congressman-elect, tested positive for COVID December 18th, died over the weekend. We have a state representative from Pennsylvania, 42 years old, recently reelected, contracted COVID in the month of December, passed away in the last few days. State senator out of Virginia, 60 years old, contracted COVID, no prior illness, died of the disease. So this disease affects many people. And when I hear people talk about percentages of fatality, and they try to adjust the numbers, their voices out there will say, well, not every death is a COVID death. This is irrelevant. This is irrelevant. This is trying to play, I would argue, political games with facts. The facts are that a person dies, their exposure to COVID is either the primary cause or an important cause for their death. And if we try to ignore it, if we try to say, well, the numbers aren't the numbers, then we're minimizing the threat. And this is a real threat. Ask it to any of the families who lost any of their people here in Westchester County. This is a serious disease. We're long past the period of calling it a hoax. We're long past the period saying it's going to clear up. We're long past the point of saying there's only 15 people who have it. We're in the middle of a pandemic. We see the light at the end of the tunnel, but we won't reach the end of the tunnel if we don't show diligence. And that's the challenge that we have here now, and that's why we share this information with you about the numbers and about the policies. Now, there's a major issue at hand in terms of vaccine distribution. We are looking at now the presence of the vaccine, and certain things have to happen in order to answer the key question that everybody has. When can I get the vaccine? That is the question. I'm in church. I walk out of church. Somebody stops me. When can I get the vaccine? When can my mother get the vaccine? I have a compromised immune system. How quickly can I get that? There are a couple of factors that will determine that. As we stand here today on Monday, January 4th, there is no official calendar that has been established by the state of New York that indicates when which different cohort of people will receive the vaccine. There are a couple of factors that go into that decision. So you understand, it's not just behind a magical curtain. The first thing is that the federal government, which has not put together a nationwide distribution plan, you've heard and you followed the reports that I have that certain promises were made to states that haven't been delivered in a timely fashion. The federal government has the resources and the responsibility to put together a national plan for distributing the vaccine to the 50 states in whatever proportion is appropriate. That has not been locked into place. There'll be a new federal administration in a few weeks. We'll see how they pick up the ball from whatever's happening now. But the bottom line is, without that guaranteed number, no state can make a predictive statement about when they can accomplish the vaccination of their people. Having said that, the state has the authority, under the governor's executive orders, to lay out a game plan, to attach target dates to it. That has not happened at this stage of the game. We assume that will happen at whatever point in time they can guarantee the numbers of vaccines that are available. Now, what has been identified is a priority list, but those priority categories have not been attached to target dates. So we know that in the first phase, all healthcare workers who have direct frontline contact with patients, direct contact with patients, were prioritized. We saw the nurse in Queens that got the first shot a couple of weeks ago. She gets the booster second shot today, I gather. She may have gotten it by now. She represents that front line of people to be vaccinated. At the same time, the next cohort are people who are in nursing homes as patients and who are staff workers in nursing homes. Those are people who we know are institutionalized because they're sick, they have serious underlying diseases, they may be of advanced age, and those people definitely need to have the vaccine. They fall in the next category. Right now, the category that we're in is those who are EMTs, emergency medical technicians, and the people who are front lines. Why would they be next over other positions? Because when they come out to respond to a 911 call or they deal with people, they perform what is functionally a medical worker function. They're interacting with people who are sick. Those people may be sick, may have COVID, and they now are exposing to themselves. So the EMTs now become the next line of defense. The state has established after that a category, that's 1A, 1B, which includes essential workers. And they have given examples of what essential workers might be, but they haven't defined it and categorized it beyond general dialogue. In that category will be other classic first responders, police and fire, education employees. So if you're teachers or you're working in a school setting and you need to have the vaccine in order for you to interact with children, that would fall into the next category. What might also fall into that category would be people who are bus drivers. We have our Beeline bus drivers. They're essential employees to us. Without the Beeline bus drivers driving the buses, then the bus system stops. And as we've seen already, we've had to cancel certain runs and lines because of COVID sickness. So hopefully we can deal with that as well. They fall into the category of essential workers. When you get further down the line, the cohorts established by the state will include people of advanced age, and it won't be all senior citizens in the first cut. There are those who are younger, senior citizens. I'd like to think that's the category I fall into at 67, who are probably at the age 75 or 70 and younger, up to 65. They are healthier. So the older seniors would be entitled to receive the vaccine as a priority. And I assume within that cohort will be people who have other kinds of health concerns, compromised immune systems, things that would represent equivalent vulnerability to the virus that you would have if you were 75, 80 years, 85 years old. Then the remaining cohort of seniors, and then we get to the general population, which far and away is going to be the greatest challenge. Now, when you turn on TV, as I do, and you see lines of cars in Tennessee and in Texas or Florida waiting to get vaccination, that's no way to do this. We are not going to set up a system in which people wait online for 4 hours to find out after 3.5 hours of waiting you've run out of vaccines. It's going to have to be done on an appointment basis, and it's going to have to be done in some targeted way. That is yet to be determined. The governor has established the responsibilities through various medical institutions. We'll talk more about that in a second or two. But the protocol for how the general population will be vaccinated has not yet been established. So for all those folks who might write me, email me, stop me when they see me on the street, when am I going to get the vaccine? Who do I call? How do I know? We are going to put information on our website, westchestergov.com. So check it every day, see if there's any updates on that. Stay in touch with your doctor, your family doctor, or the medical practice that you work with. They certainly will be informed at the earliest possibility of how this is going to be structured. And when we know how it's going to be structured, then we'll be able to give you a better idea of all those situations. We're dealing right now with vaccines as well that will go to some Westchester County employees, not all Westchester County employees. Certainly those in our public health department will be getting doses of the Moderna vaccine, and many of our nurses are going to be the ones who will then administer the vaccine to other people when we reach the next phase of this. And they are going to be up close and personal, as every nurse is. We have individuals who work for departments of labs and research who will also receive the vaccine. And then we have some of our nurses don't work in the health department, they work in the Department of Social Services, and they too will be given the vaccine. But it is not an across the board by nature of who you work for. It's the function of your job that will make that determination. And when people come and ask me, when do they think I personally am going to get the vaccine? I will take it whenever my cohort is entitled to take it. If by my age or whatever other function it is, I will then take the vaccine. I'm not afraid to take the vaccine. You should not be afraid to take the vaccine. I could just tell you I've been vaccinated all my life since I was a little boy for one reason or another. And by the grace of God, I still stand here today, these many years deep. But those COVID vaccines developed by Pfizer and BioNTech and also by Moderna are now being disseminated and will be available for all the folks that will hopefully be able to receive it over time. How long all of this will take is not knowable, but at this stage of the game, but we'll try our best to do that. I'm going to ask Deputy County Executive Ken Jenkins to come in and talk a little bit about teleworking, and then I'll return with a couple of other updated items. Ken.
Thanks, George. As the county executive indicated when we were at the beginning of the second wave at one of these news conferences, we announced the county executive's initiative in reducing the workforce by 25%, and by doing that by teleworking. So under Westchester County executive's leadership, we were able to complete that particular mission, and we are having a video clip that we want to show everyone how they can get involved. Before we show the video clip, though, we want to make sure that everyone realizes that that county workers and county departments have found that telework has resulted in more time and getting a lot more actual work done, less time spent traveling and mapping out and getting back and forth and sitting in traffic, which in turn creates a better service for all of the Westchester taxpayers. And as we're going into 2021, as County Executive mentioned earlier, as the numbers keep moving up, people have been going around and traveling and going to see family members, even in those small situations. The county's encouraging all the other employers to further adopt teleworking as we all look to remain safe from COVID-19 in 2021. With that, we're going to see a video now with the Director of Operations, Joan McDonald, and Planning Commissioner Norma Drummond, showing how well that telework has worked for us.
All of a sudden, COVID hit and just the world turned upside down. At the direction of the County Executive Latimer, we really had to rethink about how to function remotely.
Our corrections department, those employees need to be there 24/7. Our planning department, our finance department can do some of that work remotely.
For the planning department, it actually has worked well for staff to be able to function from home and from a remote place.
At the county executive's direction, we can do a lot of the work remotely through teleworking, which is great, through computers, through Zoom meetings.
We have systems in place now to better account for hours and to better account for the activities that they're doing.
My staff are working full-time from home. We have weekly meetings with the staff to discuss their progress. They report to me on a daily basis what they're going to do.
Actually, you get to do even more work because you're not always necessarily the one who's speaking or running the meeting or something like that. And so you have the ability to keep juggling a couple of things in the air while you're participating in some of these meetings.
We're actually communicating with more people than trying to get them on the phone normally.
We've been able to do county planning board meetings online, which I never would have thought that would be something that would function well because you're dealing with members of the public and other outside folks. If anything, it makes it more convenient for people because they don't have to worry about traveling there. We don't have to worry about the weather anymore.
The great thing about working for George Latimer is that he gets it. He knows that our workforce is flexible. And he gives us the leadership to make those provisions happen.
We're able to pull up documents and view things together and edit things together. And I think even going forward, even without a virus, I like to think that in the future we're going to be able to do a lot of work together.
People are getting back to that work-life balance. It allows us to look to the future with ways to be more flexible and still get the job done.
Okay, thank you very much, Ken. We appreciate that update on teleworking. Now, I want to go back to talk a little bit more about the protocol on vaccine distribution because that's a hot issue, hot topic that's being discussed. The first phase that we're in now is called Phase 1A, as established by the state. And in that distribution phase that we are in right now this week, high-risk hospital workers, emergency room workers, ICU staff, pulmonary department staff are being administered the vaccine. Residents and staff at nursing homes and other congregate care facilities, as we've mentioned, federally qualified health center employees are receiving the vaccine. EMS workers, coroners, medical examiners, and certain funeral workers are getting the vaccine. Staff and residents at some of the various facilities that are run by OPWDD, OMH, or OASAS, all of these are state agency funded group homes. Urgent care providers, individuals who are administering COVID-19 vaccines, including local health department staffs, and that's what we mentioned before about the Westchester County cohort that would be involved in this. All of these are now under the current 1A distribution of vaccines as of today. Outpatient, ambulatory, frontline, high-risk healthcare workers of any age, the staff who are in direct contact with patients, and there's a host of other ones that fall into this category. Doctors who work in private medical practices and their staffs, doctors who work in private hospitals, hospital-affiliated medical practices, doctors who work in public health clinics, registered nurses, specialty medical practices of all types, dentists and orthodontists and their staffs, psychiatrists and psychologists and their staffs, physical therapists and their staff, optometrists and their staffs, pharmacists and pharmacy aides. They all fall under the current responsibilities under Phase 1A that would be distributed. Next week, a week from today, that category opens up. It includes home care workers, hospice workers, staff of nursing homes, skilled nursing facilities who did not receive COVID vaccinations already through the pharmacy partnership, and that is within that category. Now, prior to receiving the vaccination, you must complete the New York State COVID-19 vaccine form. This form can be completed online. You get that information from our website, westchestergov.com. You'll be seeing some information as well on the screen. You can also fill out the form at your vaccination site. And if you want more information, you can go on to COVID-19 vaccine, all one category, .health.ny.gov. That's COVID-19, the number 19, vaccine.health.ny.gov, and that will give you some of the information that will tell you a little bit about the folks who are currently entitled to get vaccinations. And if you fall into one of those categories, go online, fill out the form, and we'll move forward from there. Now, today, Governor Cuomo made an announcement about his concerns at the various healthcare centers around the state. Some of them are the ones that were designated by the state to be the hubs within regions, that he wanted to make sure that they were moving faster. He was not happy with, I guess, the speed of vaccine distribution, and you saw that he tasked county executives and the mayor of New York City with managing the process. Well, I welcome any responsibility that I get. I'm more than ready to execute that, and so is my team. We do not currently run the Westchester Medical Center. It is ably run by Michael Israel, who is the chief administrator there, and there is a board of directors of the Westchester Medical Center. We make recommendations. The governor appoints members to that board, and the Board of Legislators also has some designated appointees. But it is a private hospital. Westchester Medical Center was once a department of county government, but 22 years ago it was spun off. I was in the legislature when that happened. It became a public benefit corporation, and now it's further advanced to being a private hospital. We have had no direct responsibility as a county government over the Westchester Medical Center to date. We are happy to take on responsibility to work with the leadership of the medical center to make sure that more vaccines are out as we go through this process. I'm planning to speak with Mr. Israel a little later today, and we'll have some conversation about what's going to happen. I think it's very important, though, to understand that the mission here is to make sure that as many people are vaccinated as is possible. And what happens many times in government is there's a blame game. You're watching it in Washington, D.C. We don't need to replicate that back here, where it's not as important to figure out what the problem is figure out who's the guy that's responsible for making sure that this thing gets done. We take on, as a county government, the responsibilities that are given to us, and when given additional responsibility, we take it on aggressively because we intend to accomplish it. We didn't fix the Miller House by accident. We didn't move forward on the New Rochelle Family Court and get a decision by accident. We didn't move forward on the Memorial Field task by accident. We know what we're doing when we're given the chance, and if we're given that authority today, in today's announcement, then we will take on that responsibility, we will achieve it, and we will do it cooperatively as we've done everything else. We earlier today had a report, United Westchester, in which we talked about recommendations that were made to help deal with utilities and telecommunication companies because of the two weather incidents that we had back in 2018, Riley and Quinn, as they were named, and then more recently Hurricane Isaias that happened back in August. And that cooperation was done with local governments, state legislators, county legislators in our office, because that's the way we work in Westchester County. We work cooperatively, we communicate cooperatively, we communicate transparently to the public. We don't keep it all hidden behind a shield that you have to guess at what we're doing. We know what we're doing, and if given the authority, we will accomplish the mission at hand. We take on that responsibility. I expect to speak, as I said before, to Michael Israel today, and we'll do everything we can to move that forward. And we'll do that affirmatively, and we'll do that aggressively, and we will accomplish that goal. I do think it's important to understand that there's so many things that are being decided as you go along. I think the phrase I've heard it said is you're building the plane while you're flying it. And there is no question that as we've gone forward, there have been adjustments every which way on every level of government. I mentioned previously how the protocol for quarantining has changed over time. We have color-coded zones that reflect the degree of infection of different areas. And the state, the governor created a yellow, orange, red zone structure. Haven't heard a lot about that lately, but they still exist and they still have restrictions. And we have worked with the school districts as well as the municipal governments and trying to deal with those things, overcome the problems of that area, provide PPE, put out public service announcements, and we will do the same thing in terms of vaccine distribution. As soon as we have information, we will share it publicly and openly and transparently because that's the way we operate. And that's my personal commitment. This is as much about who you are as an individual as what your title is and what your responsibilities are, what your political affiliation is. I've been in public office for a number of years. I take my responsibilities seriously. I don't take myself quite as seriously, but I do take those responsibilities seriously. Ken Jenkins and the rest of my team, Joan McDonald, Emily Saltzman, Dr. Charlita Amler, all the way through this system are professionals. We're of a certain size and scope as a county government. We're not a state government. I've talked to my colleagues, Laura Kern, County Executive from Nassau County, Mark Polenkos from Erie County. We're all prepared to take on the responsibility and achieve it. And we'll do it if given the authority that goes with the responsibility. So that's what we're looking for. We get the proper authority, with responsibility. We'll work cooperatively. We'll resolve the issue. No other comments in the briefing today to cover. We'll go to some questions in a second. I just want to repeat what I said a little bit earlier. There's a light at the end of the tunnel, but we're still in the tunnel. And we'd be foolish to think that we're almost there. Pandemic fatigue is real. I feel it. I see it out in the community. I'm in the community a lot to talk to people. Ken and I always compare notes after a weekend. He's gone to 10 places. I've gone to 10. I think he goes to 12. I go to 10 places. We compare notes, and it's the same basic reality everywhere you go. People want to be normal again. They want to have a normal economy. They want to see their families. It's a human reaction. It's an appropriate reaction. There's nothing wrong with wanting those things. But as I've said every single day from the very first one of these updates, it is still a matter of mature judgment that the things that you want to do may be the things that you can't do right now. Not because the government tells you not to do it, but because it isn't the practical thing to do in your life. And, I remark, how I thought when I was a 6 or 7-year-old child versus the way I think now. When I was that age, I needed parents to tell me what to do because given my own devices at 6 or 7, or for that matter at 16 or 17, perhaps even at 26, I might do whatever it was that I wanted to do. But now, with time and grade and maturity, you understand, we face a pandemic. Our neighbors have died. We have to avoid more death if we can, and we do that by being diligent. And when we do this properly, we get through this, then we can put the masks in the drawer and never look at them again, hopefully, in our lifetime. But until that day comes, we have to follow through. We've just gone through a period of time now where there's a lot of personal interaction. Let's hope, now that we're past those holiday seasons, we're ready to be as disciplined and as diligent as we can, get through this, get vaccinated, avoid catching the disease, reduce the spread of the disease, and by Labor Day, by 4th of July, maybe by Memorial Day, we'll celebrate. And we'll have a true celebration because it won't be fake celebration. It won't be a celebration because somebody wants you to say, oh, we're open, we're free, we're good, because it serves your purpose to say that. It'll be a true celebration, something we can really feel good about. And hopefully we'll all be here for that moment. Let's go to the questions. Catherine Chaffee.
Okay, the first question is from Samantha Crawford. Governor Cuomo said today that the Westchester Medical Center is among the bottom 10 hospitals across the state in terms of quantity of COVID vaccines administered thus far. He says perhaps some hospitals can handle the pressure of administering the vaccine. Overall, what are your thoughts on this, bearing in mind the task may become more difficult when it's the public's turn to line up for the vaccine?
Well, I don't think it's a matter of pressure, being unable to handle the pressure. I think Westchester Medical Center is a terrific institution. I think the people who are professionals over there are true professionals, and so I don't draw that as a judgment at all. I think we've seen all of us grapple with trying to do things that we haven't done before. We're in the first couple of weeks of trying to accomplish a task, and we have to put time and energy and effort in, and we have to overcome obstacles that have been put in the way. So I have not dealt with the medical center to this point on these issues. As I've said clearly, we do not as a county government have responsibility over them, but we cooperate with everybody, just with the school districts, with the municipal governments. We don't have to have authority over them to know how it works. The governor and the state has authority. They can order anything they want when they want, but if we're being tasked now, as of this morning, to work with the medical center to get better results, I'm confident that our partnership will help. What does that mean in practical terms? If somebody says, George, you have to make sure that every EMS individual is identified and treated. We went through this once before, where we had antibody testing. And we were given antibody testing availability to a wide range of people who worked for various governments, not just the county government, but local governments. We went through the protocol. We happened to have it structured at the Westchester County Center, which has been set aside for medical purposes. And we effectively went through that period. And we had antibody testing done for a large cohort of people. So I know it can be done. And I know the medical center has professionals that can help get it done. I think sometimes, though, this reminds me of the experience I had with my mom and my dad growing up, and maybe you had this experience too. I love them both. I talk about them both very fondly. My mother was nurturing. My father was a disciplinarian. Sometimes what I needed was the kick in the butt and the firm direction of a father who said to me, you better do this, boom, boom. But it was my mother who helped me. My mother sat with me and taught me how to read. My mother was the one that helped me over those moments when you come home from school and you're all upset over something somebody said and you're a little kid and you're crying about it. And my mother helped me through that. So there are times when you need that strictness. I demand that you do this. There are other times that what you need is that nurturing and that cooperation. And I think that's what we need right now. We need that cooperation between the county government with the medical center particularly, and I have every expectation that in fairly short order we'll get the things back. Because I think sometimes the directive and the anger and the authority isn't what's needed. We'll see if the way that I believe you can lead will succeed. And I think it will, because I think we have professionals that want to succeed. I think they're in the process of succeeding, and I think we can help them. We can help identify all those EMS people. We can help identify all the teachers because we work with the school districts. We already have those relationships in place. We already have the relationships in place with all of the municipal officials. Which people who work for local governments fall into these cohorts to be tested. We can pick up the phone right now and talk to any supervisor, any mayor. It's on a first name basis. We can put the cohort together pretty quickly and have those people go through vaccination and work with the medical center. And I suspect that's the way to go. So I think in this case, hearing how my dad operated, I think I'm going to operate the way my mom did. Let's work together. Let's work cooperatively, and I think we'll accomplish our mission.
The next two questions are from David Proper from the Journal News. Do you think it's unfair for Governor Cuomo to say you and the other county executives need to take personal responsibility for a vaccine rollout at public hospitals?
Well, I can say this much. I know my colleagues, Laura Curran, Mark Polenkars, who's the Erie County executive. These are leaders. We're not afraid to lead. I'm not afraid to lead. But trust me, I might be the county executive. I'm not the president of the United States. But if given authority and responsibility, I have no doubt to step forward. I served as a legislator for a long time. When given executive authority, we used executive authority. So I think it's important to understand that up to this point, the county executives have had no control over the hospitals. If at this point forward, we're going to be given authority to act with power and force, we will act with power and force, and we'll be able to accomplish missions. We have not had that authority prior to today. I don't know quite what our authority will be. We'll find out what that is. But I think that in Nassau County and Erie County and here in Westchester County and some of these other locations, New York City, we can get the results. Now, keep in mind that the hospitals of Westchester County, all of them, including the Westchester Medical Center, are not public hospitals. New York City is different. New York City has a Health and Hospitals Corporation, and many of the hospitals that you see in New York City are run by the municipal government. So if somebody says, well, the mayor of New York, he has control over the hospitals, well, that's true. Give you the analogy of school districts. Westchester County does not run school districts. School districts, with one exception in this county, are all run by separate independent school districts and school boards. And they have school trustees, and they appoint a school superintendent, and they make those decisions. You can't go to the mayor of White Plains and talk about the White Plains School District. You can't go to the mayor of Peekskill and talk about the Peekskill School District. They don't have the authority to do it. Only in the city of Yonkers does that exist. New York City is a different cat. New York City runs the schools. New York City runs most of the health and hospital facilities. Not all of them, but they have a public set of hospitals. We do not have that. So what we're being asked to do or required to do is to step in an area where we don't have current authority and use our leadership skills to accomplish it. I have confidence in Laura Curran. I have confidence in Mark Polenkars, and I have confidence in Ken Jenkins, Joan McDonald, Emily Saltzman, Charlita Amler, Andrew Ferris, the people of my team, that we'll work with the medical center and we'll get the results that are necessary.
Okay. The last question also comes from David Proper. How well do you think the state has performed with the vaccine rollout, and should they allow the health departments to take on a stronger role?
Well, the county is ready to do whatever it is that the county government can do. We're a fairly large county, but we are not a state government. We don't have the resources of a state government, and we don't position ourselves as a state government. I've said this many times, probably not on camera, but when I'm talking with our colleagues in local government, I say we're a sibling government. We're local government. We're a big local government. We're like the oldest, biggest child in a family. Mom and dad would be the state and the federal government. They're the ones with more authority. We're all tools of the state. The state can do many things with us that we can't do. But we view ourselves as the oldest brother, and if you are in a large family and you are the oldest sibling, you take responsibility for your siblings. You can't order them around, but you can help and coordinate and do things with them. And that's how we view our role as a government with that. I think that the state government has been given a very difficult task, particularly because of the lack of federal leadership. And so now each state is doing their own thing, and each one is trying to come up with their own protocol. New York State's a big state, 19 million people, spread out over 400 some odd miles from Montauk to Buffalo. Because I've served in the state legislature, I've traveled the state extensively, I know the state reasonably well for a person who lives in one corner of the state. It's very hard to craft something that will work equally well in New York City, in the Adirondacks, out in Montauk, and also in the southern tier leading out to Jamestown and Olean and Fredonia. So the task that the state has is much more difficult in many ways than the county does. My attitude was formed in my corporate years, not in my governmental years, that you hire good people, you give them authority, you check them, but you don't micromanage them. And I think the results of our government for these 3 years prove that that is the wisest possible way to go. You don't hire people and fire them like a revolving door. You don't hire them, talented people, and then micromanage them because you yourself want to, be the, as somebody once said about Theodore Roosevelt, you want to be the bride at every wedding, you want to be the baby at every christening, and the corpse at every funeral. You want to be the center of attention. I want to be the center of attention. I want to accomplish some things. And so I think that the way we approach it structurally from our level of government can be effective. And the county level of government under this philosophy, not necessarily the past philosophies that were here previously, but under our philosophy is flexible enough to be able to look at these challenges and do the best we can. But we are not as big and as powerful as the state government is. So we need the state government to say, you know what, we think this will be better done if we give you the authority, county governments, to do these things, and then we will take the Shalita Amlers and the Michael Orths and all the other professionals around the table. We'll figure it out. We'll come up with a strategy, and we'll accomplish it. We'll make mistakes. I mean, it must be almost sacrilegious for someone in public office to say, well, I could make a mistake. I don't hear it much in Washington. Don't even hear it that much in Albany, to be honest with you, and I was there for 13 years. People can't admit that, yes, we made a mistake, and we're going to move it in a different direction. We're going to move forward. But that flexibility, the ability to understand if you made a mistake and correct it, is essential if what you want to accomplish is the end result. And that's what I was taught in corporate life. And that's where my corporate life gives me, I think, an advantage over people that I deal with every day who have only done government. That's all they've ever done. Government is good. Government is powerful. But there's a certain discipline in the corporate world. You'd get the same discipline in the military, probably times 10. But it makes you focused on an end product, not just on the process. And so I'm confident that this county government and the other county governments that were identified, I saw the grid, I saw my colleagues in other different parts of the state. I have confidence that they and we will do the job necessary. But members of the press will check on us, and we will dialogue with them. We'll dialogue with them openly. Won't be hostile. We understand they have a job to do. We have a job to do. Any other questions? Thank you very much for watching. I'm George Latimer, County Executive. We will be back, I believe, on Thursday with another update. We will come sooner if there's more information to tell. We're certainly going to monitor how we're going to handle the rollout of this issue. And if we do, in fact, have some more concrete information to share, we won't wait until Thursday. But the numbers are now available on our dashboard. And we've improved the visual look of the dashboard. There is some additional information on that than what we had previously, but we are still waiting for the state to allow us to have the data necessary so we can post information about other statistics that people want to know. Just understand that we are trying to make this available. We're tinkering with it every day. We're trying to make it a little better every day so that you have a place to go to 24 hours of the day. If you can't sleep in the middle of the night, you want to look at the dashboard, it's there waiting for you. So hopefully all of that will happen. And we'll look forward to talking to you soon. Stay safe. Have a good week.